Hello, good afternoon everyone and welcome to the 44th installment of the Stop COVID Deaths webinar series. And we are glad that you continue to join us in this learning journey as we continue the conversation on COVID-19. During our webinar number 18 po, no, that was our very first national town hall meeting for hospitals with the topic Keeping Our Healthcare Workers Safe, the PGH Experience. Today po, we are back with part 2 of that national town hall meeting for hospitals. At ngayon na po na mayroon na pong mga bakuna, tatanungin po natin against the backdrop of the vaccination program rollout, paano na po ito natutulungan or nakakaapekto po sa ating mga kaso, lalo na po ngayon na meron po tayong surge ng mga cases. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center at the National Institutes of Health, UP Manila. And today will be a momentous event just because we have really a spectacular lineup of panelists for today. And as always, it's a pleasure to say that every Friday I get to share the hosting duties with my partner in crime and my mentor, our adjunct research faculty at the National Telehealth Center and also the special envoy of the President for Global Health Initiatives, Dr. Susie Pineda Mercado. Dr. Susie?
Hi Raymond, and magandang araw po sa inyo lahat. Good morning, good evening to all of you good afternoon to all of you who are watching and those who are watching on the playback on YouTube and Facebook. Welcome to another session of Stop COVID Deaths. We are looking forward to a very interesting conversation, and I just want to greet Raymond from Baguio City, Negros Oriental, Iloilo, Dumaguete, Amang Rodriguez Hospital, Tamulatan Medical Hospital, Nueva Vizcaya, Isabela, Bataan, Malaybalay, Bukidnon, Antipolo, Cainta, Davao, Iligan, UP Manila, Santa Rosa, Laguna, CAR, San Mateo, Rizal, Batangas, Palawan, Angeles City, napakarami po, no? So welcome to all of you. Thank you for joining us. Kung hindi po sa inyo, wala kami rito, and we hope that this webinar really gives you a chance to access some of the leading, what should I say? Not some, but the leading doctors and resource persons and experts in the country who are handling the pandemic. And as Raymond said, it's a learning experience for all of us. So today it's a national town hall meeting. We've got 3 hospital chiefs. The 3 chiefs of hospitals, of the COVID hospitals, are here to share what's going on. And we have noticed an increase in cases. Meron nga bang surge? Hindi ko pa masasagot yun. Pero samahan niyo po kami. I think there's a lot that we can learn together today. Over to you, Raymond.
Thank you, Dr. Susie. As mentioned po, no, it's we have, and as shown in our opening billboard, we have a great lineup of speakers for today, but the lineup really and the whole production will not be possible without the very hardworking team behind the Stop COVID Deaths webinar series. Maraming salamat po for making this learning series possible. And this will be just a testament po, since we are now on webinar 44. In just 8 more webinars, we will have marked our our 1-year anniversary po, no? The virus has really shaken us and provide us with several areas of concern, but also opportunities to learn more about more of a biological entities and more on how to combat these and the need to improve our public health measures. So I hope all those who will be logging in, and just based on our number of registrants who numbered 2,879 registered attendees po para po dito sa webinar na ito. We hope to be able to get most, if not all of you, in this Zoom. Kung kayo man po ay nanonood sa Facebook live streaming, sa YouTube po, sana po ay mas marami pa po kayong maanyayahan na makadalo. Over to you, Dr. Susie.
Thank you very much, Raymond. And it's webinar number 44. Can you imagine, Raymond? 44 weeks natin ginagawa to. Hindi naman po kami magsasawa. There's always so much that we have to learn, and we have to keep up with the developments in science. I also want to just recognize that we have many people watching from the hospitals of Metro Manila. So of course, from the Philippine General Hospital, from Quirino Memorial Medical Center, nabanggit ko kanina yung Amang Rodriguez, Tonto Medical Center. Ang dami, no? We have more coming in from Mindanao. So I think I saw here Surigao, Davao, Zamboanga. So we're all here. We're all ears. We all want to learn, and we're all a little concerned kasi mukhang dumami nga ang mga kaso. But we want to be able to interpret that without being afraid. We want to try to understand what's happening and what we need to do. So over to you, Raymond. I think people want to know about their certificates of attendance.
Thank you, Dr. Susie. So thank you to TVUP for displaying our sample certificate of attendance. Gaya po ng nasabi na po natin sa ating mga previous webinars, and this is very important information, especially for those who are joining us for the very first time. No, certificates will only be issued for those who have attended at least 50% of the webinar duration dito po sa Zoom. If you have attended it outside of the Zoom, you will have to inform us about that so that we know and be able to track down and list and give you a copy of your certificate along with a copy of the presentation po of the speakers, assuming of course that they agree or approve of the dissemination of that resource material. Okay, let's start the ball rolling. Dr. Susie.
Okay, so our opening speaker is not somebody you don't know. And in fact, he's our lifeline to the IATF and to the National Task Force because Executive Vice President of UP, Dr. Ted Herbosa, not only has a huge following on social media, but now more people are following him because he was one of the first who was vaccinated. And I tell you, he's our lifeline to what's happening nationally because we usually talk about the clinical aspects of COVID-19 and management, but we also need to know what's happening, what's the bigger picture. So welcome, Ted, to your webinar.
Thank you, Susie, and good morning and good afternoon, good evening. Mabuhay to all the dedicated patrons of Stop COVID Deaths. First, let me congratulate...
Teka muna, Ted. Parang maganda yata yung background mo. Where are you?
I'm at the National Vaccine Operation Center. Yeah, I'm at the National Vaccine Operation Center. This is not my house. So
Okay.
I physically work here. We are mandated at the Vaccine Operation Center to actually come here physically, risk our lives. Hopefully, I got my shot already. This is at the Camp Aguinaldo, in Camp Aguinaldo, at the Armed Forces of the Philippines Commissioned Officers Club.
Okay.
There are two big halls that have been converted to the command center, the National Incident Command Center of the National Task Force, and the other room has been converted to the National Vaccine Operation Center, where multiple agencies sit, and we have dashboards and monitoring the vaccination program as it happens.
So this is a new, what is it? It's a new space that's been set
No,
up.
this is what we've been using since the beginning of the creation of the National Task Force. So this is our headquarters, and what was moved out was the response, the task group response. The task group response was moved to the building of the National Disaster Risk Reduction and Management Council, also here in Camp Aguinaldo. And the task group response is now busy again because of the increasing number of cases.
Wow. Okay. So there you go, right in the middle of all operations. Okay, go ahead, Ted. Please give your message.
Allah, wait.
Could you try again?
Sorry. Well, what happened here? Okay, so first of all, let me congratulate the many weekly invited speakers and all of you patrons and participants of this Stop COVID Deaths webinar. This was initially just a small idea that became a big project. It started almost a year ago now, and it's fantastic how 11 months have gone by. And we're now on our 44th episode. How fast time has gone by. And in the beginning of the pandemic last year, there was so little reliable information about COVID that was available. Fear and chaos prevailed, and many doctors and nurses even died from COVID. It was at this background that Dr. Susie Mercado approached me about hosting a webinar to give a megaphone to a few experts who initially had real experience on how to treat COVID cases. Hence the title, Stop COVID Deaths, of this seminar. With that push of Dr. Susie Mercado, I connected the dots that were already in place. The National Telehealth Center, led here by Raymond Sarmiento at UP Manila, had been a grandfather of health-related webinars since it was established. The TVUP, under the office of the UP President, was established as an alternative medium for a digital classroom or learning environment, a format with a reach far greater than the geographical spaces of our university campus. Then I asked the help of the UP office of the Vice President for Public Affairs, led by VP Neni Pernia, that hosts the UP Systems webinars regularly. This combination or collaboration created this weekly webinar, now actually on our third season. Over 40 webinars have been created, and you can return to those previous webinars at our TVUP sites on YouTube. Thousands faithfully attend, watch, and learn from our experts that we invite weekly. Your continued support has emboldened us not to stop and continue improving these offerings. We, the community at the University of the Philippines, not only offer academic programs, but aim to share our research, our experiences, and our knowledge creation in the different fields of expertise that they are involved in. I congratulate all the invited speakers today. They are our today's national heroes who have shown their dedication, sacrifice, and leadership in the fight against COVID by leading 3 of the top COVID referral hospitals throughout this pandemic. Today is a national town hall meeting as Stop COVID Deaths tries to wade through the new events taking place, brought about by the current surge, not only in communities, but also in these healthcare institutions like the Philippine General Hospital, the Lung Center of the Philippines, and the Dr. Jose N. Rodriguez Memorial Medical Center. Is the surge due to the slackening of human behavior or the preventing its transmission, or is it the proliferation of several variants detected by another UP unit, the Philippine Genome Center at the National Science Complex in UP Diliman? We thank the numerous participants who come back every Friday to support us by sharing your valuable time with us. Sorry about that. Siri is trying to talk to me. So anyway, I really appreciate the fact that people have been coming here and attending weekly. We do hope we can answer all these questions. Is there a surge? What is our contingency plan? What is the plan of the referral hospitals? And what are we going to do? Maraming salamat po and have a good day. Thank you, Susie.
Thank you very much. That's Dr. Ted Herbosa, Executive Vice President of the University of the Philippines and also the advisor to the National Task Force on COVID-19. So Raymond, we're going to talk about, we're calling it a national town hall meeting for hospitals because our guests are actually hospital chiefs, but we have invited also an infectious disease specialist to talk about these increasing numbers and whether or not we're going to call it a surge. I'd like to encourage everyone to put your questions in the chat box. We will talk about testing. We will talk about vaccination. We will talk about treatment. We will talk about health worker safety and protection. And I think we want to focus a little bit on with the vaccination, meron bang magbabago? Is it going to be new or better for our health workers? Because at the end of the day, this webinar series is made for you, for the frontliners. And hopefully we learn something from what the big hospitals are doing. So over to you, Raymond, for our opinion poll. So the poll is not, there's no right or wrong answer, I think. But it's more about what do you think? What do you think is
Right.
Raymond, over to you. Go ahead.
Thank you, Dr. Susie, and thank you, EVP Ted. I think that was the very first time that someone called me the grandfather of something. That's
Matanda ka na, Raymond. 44 years ka nang nag-webinar.
That was a surprise. That was a surprise. Anyway, for those who are in the Zoom po, please input your answers for our just very, very fun audience survey and subsequently our opinion poll. What place are you viewing the webinar from? Wag po kayong mahiya, wag po kayong mangimi na mag-answer po. Obviously, we want to be able to just get good grasp of the distribution of those who are attending our weekly webinars. So please input your answers. We understand that we have those who have registered from Apalit, Pampanga, from the Romblon State University in Ojongan, Romblon, from Dr. Pablo O. Torre Memorial Hospital in Bacolod, Western Visayas, from Lanao del Norte Provincial Hospital in Iligan City, and from the Dr. Arturo P. Pingoy Medical Center in Coronadal City in Soc Sargent. Internationally, ito po, very first time, I believe, from Sasil, Italy. I don't know if I'm pronouncing that correctly. From Bonn, Germany, Omag, Northern Ireland, Lexington, Virginia, in the United States, Tyler, Texas, Buena Park, California, and Niagara Falls, Ontario, Canada. We also have our regulars from the Middle East, Al-Khobar, Saudi Arabia, Dubai, United Arab Emirates, Doha, Qatar, Kuwait, and then from India, Indonesia, Ho Chi Minh, Vietnam, Terengganu, Malaysia, and Taipei City in Taiwan. Next up is what is your line of work? Very consistent po with our previous webinars. We have a lot of those who are in the nursing field who are tuned in dito po sa ating weekly webinar, followed by those in the medical field. Maraming salamat po. We tried to parse it, yung pong ating mga others, so that mas mapalabas na po namin, lalo na po yung mga dentists, midwives, medical technology. So hopefully, we could get a sense of how many you are there. And then the next questions po will be more about the technical aspects and technical questions related to this webinar. I will read them and the options thereafter. The question reads, there is a significant increase in COVID-19 cases. What do you think is the cause? Option A, relaxing of public health measures such as wearing of masks and face shields, physical distancing, etc. Option B, COVID-19 variants. Option C, more mobility. And option D, all of the above. Next question. Why do you think there is an increase in hospital admissions? Option A, increase in COVID-19 infections. Option B, limited access to community quarantine facilities. Option C, more aggressive testing. And option D, all of the above. And then finally, our fifth and last question, what should we do about the increasing cases? So we have citywide lockdown, localized lockdown, aggressive community testing, wear mask and shield, avoid unnecessary interaction with people. We pray, we only get information from trusted sources, and we get vaccinated. So we won't be ending the poll anytime soon. So please key in your answers po as we move on to the rest of our program. Dr. Susie?
Yes. So again, thank you, Raymond, for that, and just continue to answer the questions. We put these poll questions so that we have takeaway messages and we have something to remember and to discuss later on with our panelists. We're going to ask EVP Ted to stay with us for the panel later. And but before that, TVUP has tried to get an opinion poll also from, not a poll, but opinions from ordinary people who are maybe thinking about what's going on. So let's turn over to TVUP for your interviews.
So meron tayong search ngayon, pero dahil hindi ako epidemiologist, hindi ko maaring hulaan. I cannot guess what caused the surge.
Siguro may nakikita ko ngayon na mas na tumataas kasi napapabayaan na rin yung iba kasi talagang hindi rin sumusunod sa health protocol katulad sa mga palengke. Masyado na rin ngayon siksikan.
Medyo nga tumataas pero siguro dahil yung tingin ng karamihan ng tao, ng mga Filipino ay dahil may vaccine na kaya medyo lumuluwag na rin sila, nagpupunta na hindi na katulad nung dati na mas mahigpit.
There is more mobility sa mga people are more willing to break quarantine regulations.
Mas lalo ako nababahala ngayon, lalo na sa pamilya ko at sa sarili ko din kasi nagko-commute ako araw-araw pag pumapasok ako sa trabaho.
Kampante ba ako sa vaccine situation ngayon? I think the answer for most people, as it is for myself, is no.
Sa ngayon po, hindi po ako kampante kasi hindi pa naman napapatunayan na talagang epektibo yung vaccine. Pero kung talagang epektibo siya, mas okay sana. Para hindi na tayo nangangamba na mas tataas yung COVID-19.
Okay naman yung vaccine, although medyo konti yung dumarating. Pero so far, so good naman yung sa tingin ko. Basta ang tingin ko dapat lang mabilis na madagdagan pa yung mga parating na vaccine.
Sana matapos na itong krisis na nangyayari sa ating bansa, hindi lang sa ating bansa kundi sa buong mundo. Kasi napakarami ng apektadong tao na nadadamay, namamatay, nawawala ng trabaho.
Siguro wag muna tayong magkampante dahil akala natin may vaccine na, pwede na tayong magkampante. So medyo strict pa rin sa pagsusuot ng face mask, kung kailangan din ng face shield.
Nasa tao na rin yun eh. Kung may disiplina tayo sa mga sarili natin, kung susunod tayo sa mga protocols, hindi na dami yun eh. Tsaka kung marunong tayo makiisa.
Thank you very much, TVUP, for those interviews of persons on the street, ordinary people, sharing their views on what the situation is. So, without further ado, let's bring in our first speaker again, someone who is not new to you, and somebody who has been endeared to the public because he was the first one to be vaccinated with Sinovac at the Philippine General Hospital. I'd like to welcome PGH Director Dr. Gap Legaspi. Gap, kamusta ka na dyan?
Morning. Good morning. Okay naman. It's been almost 2 weeks since the vaccination and nothing unusual. In fact, nothing at all after the vaccination. Pero we continue to vaccinate everyone as they come. Yeah.
Great, Gap. We're just always so happy to see you with us on the webinar, and a lot of people look forward to listening to you. You know, Gap is not somebody who hugs the limelight or likes to be seen in public, but when we do get to see you, we really do appreciate your views, your reflections, and your thoughts on how we're going to get out of this. And I think you said we are getting out of this. There seems to be light coming out of the tunnel. So, Gap, let's go ahead with your presentation.
If I may share my screen. Okay. I think this afternoon is my fourth or fifth time to appear in the webinar, and I'm happy to know that I'm almost 4% of the of the total webinar hosting that you've had, and I'm proud to say that. With a quite difficult topic now because there's a lot of speculation about it. Is there really a surge? I think it's a difficult term to qualify. But I guess for now, everyone agrees at least that there's a spike. Even the WHO calls it a spike and not really willing to call it a surge. But just to give you a background on what's happening and how people are interpreting it, I was in an NTF meeting and I borrowed some of the slides because I think it drives a very important message for us to understand what's really happening. We all know that the cases have been going up, and and this is no secret to every one of us that it started, when the month of March, even before the end of Feb happened, we already started seeing the number of cases going up, and steadily it has been a rollout of increasing numbers by the day, exceeding what we have seen in the last 3 or 4 months, but not at least not still quite the peak that we saw in July and August of this year. So there's still some room for us to maybe reflect and intervene before that peak happens again when we were forced to go to another MECQ. So the big question here is this because of the recently announced presence of another variant, the B.1.351, the Brazilian, the South African variant, which is supposed to be more transmittable, but not proven to be any deadlier than than the other variants that have been present around us all this time. No? So it was announced on March 5, but actually tracing back the specimen as early as January, there was already one identified in Pasay, but most of them are starting to be seen in increasing number at the tail end last 2 weeks of February. So if you they mapped out the presence of these different variants, the UK and the South African variant, the dark ones being the UK variant and the yellow ones being the South African variant. And you see that the distribution is centered, the variants are centered in the very populous areas near the Bay, Parañaque, Makati, Manila, no? Quezon City, of course, being a highly dense area, has its own share, Pasig and Las Piñas. And to our woes, of course, PGH is right in the middle of all of these dots. And that's why we were quite alarmed that being caught by surprise. So we started instituting ways, which I will discuss with you later. So a lot of these variants also were traced to Pasay because that's where the entry of our returning overseas Filipinos and foreign nationals are. If you compare this now to the transmission of COVID-19 in areas, they somehow follow a pattern that again is concentrated on the central part of the NCR, around the Manila, Pasay, Navotas, Malabon area, which are all contiguous, again, around PGH. Surprisingly, the others that have that the variants were identified, like Quezon City or Pasig or Las Piñas, are not seen as hotspots now. So maybe this growth will support the fact that there's something else that's happening aside from the virus, the more transmittable virus being present. And as I said, the alarming growth rate of around 121.4% in these high-risk areas has driven a lot of the hospitals to go into Plan B, so to speak, after all these months of being in relaxed mode. No? So this is just, again, a distribution of the variants, the UK variant on the left and the South African variant on the right. And you see that there's no increased concentration. There's low percentage of those identified in the specimen submitted, again showing a high concentration of numbers in the returning overseas Filipinos. So there is no increased detection in any given area, but if you now compare the two areas of the distribution and the hotspots and the increased transmission rate, attack rates, there seems to be no concordance, no, between the two. Pasig here, Quezon City there, no, and what is quite obvious is that the proximity of the borders of the majority of the borders of these cities affected is being identified now as the factor of mobility among the citizens in these different cities. No? So if you map it out based on that, then the conclusion from the National Task Force is we have become infected because we have been lax with our minimum health protocols. And that I think from those data, it is, and I hope Dr. Berba will shed light on this later, if she agrees or not, that the UK and South African variants are not the only reason for the case increase that we see. I think it's a common feeling now that it's probably the pandemic fatigue that we're all feeling, and the seemingly low numbers we've had in the last few months that made us bolder to come out, and some of us even violate our health protocols. So I was in Greenbelt the other day, and there are already musicians just this weekend, and there are musicians already playing on the in the bars there as if it was not pandemic anymore. No? So I guess people are starting to just trying to live out their normal lives and forgetting about the minimum health protocols. That could be, on a practical basis, be one of the reasons. So what is all this number doing to us? No? These numbers have also been reflected as an increase in our daily census of admitted COVID-related cases, both probable and suspect. But I think 98% COVID and 2% probable or suspect, reaching our peak yesterday, the other day at 111. No? Our lowest was around 60 or 58 at one point. In fact, we closed some of the wards already when more non-COVID patients are coming in. There was one day that there were 100 patients in the ER and only three were actually COVID cases. So you can now imagine the pressure of admitting non-COVID patients who come to PGH as their last resort, and referral hospital, as most big government hospitals are. So we are now in the process of calibrating our wards into responding to this increasing in number, hopefully not prolonged, but nonetheless, we are still responding appropriately to it. So what we discovered also is that our ability to transfer patients into PGH from early mid-February to around late February was still okay. No, we were still able to get in the COVID referrals that were coming in. But in the last few days, because of the rapid rise in number, our ability to admit these patients have decreased, hence forcing us to open up our wards. And right now, from almost 70 before this rise in number happened, we are now back to 168 beds for COVID patients. What we've seen is that not too much pediatrics patients are coming in or obstetric patients are coming in. So mainly just the adults with concomitant medical problems. So we are now, we have ramped up to 168. At our maximum before was 230, 240. And we are ready to do that if needed. But as I said, because of the huge demand for non-COVID beds by our urgent and semi-urgent non-COVID patients, force us to use the other wards first for them. So I think this is a good estimate of, I hope this is our a good estimate and a good projection of eventually the beds that we will need until we ride out this spike or this surge and later on as we figure it out in the next few weeks to come. So how did this affect our health workers? I think it is apparent that the problem in the hospitals is actually a reflection of the problem in the community. Just like to share with you, we wanted to find out in the last 10 months how COVID has crept into PGH knowingly or unknowingly. We did a zero surveillance of almost 3,000 healthcare workers, and this was done before we rolled out the vaccine. And we found out that 74% of our healthcare workers were never sick and never had and did not have any evidence of antibody reaction to the presence of previous COVID infection. Of course, it could have faded through the months, but at least we interpret it as such for now because it's the data that is currently available to us. So that means 26% have had either known COVID infection or unknown COVID infection as reflected by an antibody reaction that 8% of them had. No? So it is interesting to note that the 11% who had COVID, non-COVID infections still had their antibodies present in the testing that was done in February, and those that had COVID infection, of which are 7%, lost antibody to COVID-19 already. No? So they can still be infected, and hence the value of vaccinating this personnel as well. But there's an 8% of our population that had no symptoms at all, no, and detailed questioning, but still had serum antibodies in their serum, and was deemed to be infectious at some point. So this is an important message for us to say that no, it could really be with us without us knowing it, and I think that's very obvious in the days that are coming. So again, going back to the community report, our healthcare worker curve follows the same curve that the community has been displaying. So truly, healthcare worker infection is a reflection of community infection. So I think because of this spike, our HICU, led by Dr. Berba, issued an alert on March 4 when we recorded 15 positive COVID patients, COVID healthcare workers in 4 days, equivalent to the monthly that we've had since December. So I think the infection was again linked to infection to sick co-workers who still reported without telling their colleagues that there's some symptom that they're feeling, and eating together, exposing others to the transmission of this virus. So in light of these observations, we had an early alert, and I think that was what was leaked to the media. So there was a huge exchange of Viber message, a small message becoming longer and longer, being other people adding their 2 cents worth to that message until it went viral. So just to be more specific with the situation that we had here. In February 25 to 28, anesthesia reported 4 residents who tested COVID when one of them became symptomatic, and the exposed colleagues also tested positive. And the contact tracing eventually led to 4 more residents turning positive, eventually becoming 12 in the anesthesia group, and forcing us to quarantine 36 high-risk patients and the different subgroups in anesthesia, like the utility workers and the administrative officers. So the spike of infection in the anesthesia group forced us to trace it further, of course, to the nearest subgroup, which is the surgery department, because they work closely together. Although the transmission in the anesthesia group was traced to a call room where there is close contact between the residents during their off hours, rest hours, and the whole anesthesia and the surgery residents were quarantined initially, and testing was done, and 10 of them turned out to be positive, and as well as 4 interns who got exposed to the residents, and maybe some of the anesthesia residents also. So it was really a nightmare for us to be in such a whirlwind of increasing infection. But fortunately, unlike before, most of the infections were either asymptomatic or mild. I think only 2 of the eventually the 45, maybe 3 of the 45 who were initially identified got admitted for symptoms. So we also got the surprise of our lives when one of the residents in surgery who was positive in February turned out to have the South African variant. And again, you can imagine what kind of frenzy this cost us because of the reportedly increased transmission of the virus. But fortunately, tracing back the initial contacts all turned out negative until we were able to trace back after the resident has reported back to work, because after 2 weeks, he was allowed to go back to work. And when we got the result, I think on March 3, and he was already on March 5, and he was already on duty, we traced back again contacts, and we had 2 residents that were positive on the second generation contacts after identifying the virus, but all asymptomatic. So it is really quite disturbing to for us to be getting all of this. But to our surprise, it was not exclusive to the Department of Surgery and Anesthesia. Psychiatry also had their spot explosion of COVID positive staff members, traced back to a psychiatric consultant where they had a face-to-face webinar slash hybrid webinar. And I think the consultant was unknowingly positive and exposed residents and who eventually turned out to be positive in 2 of the 10. So this is a completely isolated event from the surgery and anesthesia. And then we had our child protection unit, which is a standalone unit outside of the hospital, again giving us a positive consultant with some nurses turning positive on the contact tracing also. So in general, so in summary, this is what has happened with our healthcare workers from March 1 to 8. And I think the conclusions that we get there is that most of the early infections that we got were linked to eating together in closed spaces without their masks. No? And that the actual link to occupational exposure happened in the neuro ICU, where a previously negative patient turned out to be positive and had to be intubated, and 2 nursing staff eventually had positive. Now, prior to this, our only other occupation link exposure was early last year, late middle of last year, when again during an aerosol producing intubation, residents were exposed without proper PPE. So these are the conclusions probably that we can get, that most of the infections came from links to community and not from the patient themselves, except for maybe a few, 1 or 2 that were identified in the ICU. So this again sends a message that the occurrence of infection in healthcare workers in this last rise that we have is really more linked to violation of health protocols or relaxing of health protocols. So the reflection on the services that we can render is really tremendous in terms of anesthesia and surgical activities. So steps that we took, of course, were to reduce the number of personnel in the hospital, and the easiest to remove from the hospital will be our students, medical clerks, and the interns. So there are 150 of them at a given time in the hospital. We asked them to go home, but still continued to monitor them. We deferred all elective medical and surgical admissions, just like what we did at the start of COVID in March. And we changed our minimum health minimum mask from surgical to KN95, and fit tested at that. We deferred OPD walk-ins, but we still accepted OPD face-to-face OPD consults, but pre-arranged through our online consultation network. We adjusted the meal activities. Again, eating being the number one area, eating together being the number one factor in the spread of this virus. We made more. We added more personnel to allow us to do faster and more aggressive contact tracing, and we've submitted our samples to gene sequencing just to see how the South African virus is spreading within our healthcare workers. And I think we submitted that specimen yesterday. Those groups of specimen yesterday. Our testing still targeted, meaning just based on the exposures and the risks of patients and the probability of spreading it. And we noted an increasing positivity rate of at as high as 15%, and we were down to around 2 or 3% in the past. No? However, the increasing number of healthcare workers being infected forced us to abandon our initial high-risk, low-risk categorization for testing, and we just tested everyone, of course, timed after exposure, who got exposed to a positive healthcare worker. So I think that's one thing we changed also. So we reminded everyone of the universal pandemic precautions, and that the healthcare worker actually has a lot of risk areas where he can get the infection, so that they are forced, or they're reminded to again exercise the health protocols that were instituted. So um, with this in place, we have been giving out daily HICU alerts and HICU reminders on how to avoid transmitting this, and of course, on how to interpret also the data that we're having, to avoid any confusion and maybe even panic among the healthcare workers, because we very well know there are hundreds of people in the vaccination area, and one false information can affect the confidence of our healthcare workers going to the vaccination area for their shots. No? So I guess that's how we rolled out our management of the healthcare infection. I'm happy to know that it's leveling out as the week is ending. We are resuming some of the operations next week already, opening some of the operating rooms, but still reducing the number of people coming into PGH for now. So, and just to round off the discussion on and give you an update on the COVID vaccination, because I think I presented 2 weeks ago on the plans for this. We have prepared very well for this. I think we have done 3 or 4 simulations before this rollout, and this is the night before when finally the vaccine came on a Sunday, and we rolled it out on a Monday, March 1, to a fanfare and festivity that was, of course, a violation of the health protocols that we had. But everyone is so excited. We just had to keep reminding everyone of the distancing and the masking. So as you very well know, I got the first vaccine, and I'm happy to note that the first 5 were actually all from UP. That's why I call them the first 5 of the UP Maroons. Dr. Eric Domingo of FDA, Dr. Mingita Padilla of Santa Lucia IBank, Dr. Edsel Salvania of the NITAG, and of course, Dr. Mike T, our Vice Chancellor for Planning and Development. So we were all together as the first 5 in the monitoring area after vaccination. And then, of course, the big impact came when the Dean and the Chancellor took in the vaccine that was available, Sinovac. Based, again, I think I heard Dr. Padilla even called in the experts to her office to explain to her what the choices are. And finally, she had herself vaccinated with Sinovac, and the Dean as well. So these are the 3 people who run UP Manila, and hopefully set a good example for confidence of on vaccination. And as we roll out the AstraZeneca, we are now taking in the more senior ones. These are all legends in medicine and in surgery. Dr. Charlie Magsanok, 88 years old. Dr. Tony Limson, 86 years old. Dr. Periquet, Antonio Periquet, former Assistant Director for Health Operations, 85 years old. Dr. Senon Cruz, 89 years old, our anesthesiologist. Of course, our national scientist, Dr. Ernie Domingo, and his wife, Dr. Camelita Domingo. Former director of PGH, Dr. Salvador Salceda. And our oldest vaccinee was Dr. Dick Chonko, our surgeon mentor for the longest time. So it was really great to see all of them. And I think the biggest thing that came out of this vaccination is that the hope that it has given us, that finally we are in the last step, in the penultimate, the last 2 seconds of our fight against COVID, but nonetheless still the worst, expecting the worst from our everyday current challenges. So so far, nationally, as far the rollout has been at 15.4%, with NCR showing the highest at 35.9% of the healthcare workers vaccinated, and 15.4% of 1 million healthcare workers in the master list, priority master list of the DOH. In PGH, we have already vaccinated 51.8%, both with Sinovac and AstraZeneca. And I think the numbers have shown that the confidence with Sinovac, which is really CoronaVac, which was really low at the start, started to improve after the initial day of vaccination. And we were able to almost completely consume the 2,000 allotted to us. The AstraZeneca is also getting off to a good start, a good roll. And as I said, we are seeing a lot of our senior consultants coming in for this also. So I think there is no use comparing the vaccines anymore at this point. I think that's the point is that we already took in whatever was available, and I think there's no regrets. There are no regrets for any of those in any of these groups. So we have 5 more days to go for our vaccination. Hopefully, we're able to hit our target of around 5,000 vaccinees in the next 10 days that will ensue for this AstraZeneca. So just some observations. For Sinovac, we observed that there were two severe reactions, anaphylactic reactions that necessitated epinephrine injection, but they're both doing well. And the most common complaint is local pain followed by headache. In AstraZeneca, the overall observation is that there are more reported side effects. Again, local pain, but fever is more seen with AstraZeneca, and the body aches. That's why, knowing from previous experiences of other hospitals, that the in UK, especially, the reports there that sometimes the vaccination paralyzes one unit because 100 nurses probably are not reporting to work because of the side effects. So we decided to just schedule our vaccinees and send only for them to send only 10% of their unit per day. So this allowed us to prepare for any eventuality if the 10% are not able to come. 90% of the personnel of that unit are still there. So because of that, also we are on closer follow-up with these patients. Surprisingly, the very few seniors report any side effects. And I think the pleasant surprise that we had is that we were able to extract 11 doses with the LDS syringes were available. So we will have 500 extra doses from our 500 vial supply. So with that, I'm ending my talk and ending it with a huge expression of gratitude to our vaccination team, our hospital infection control unit, of course, the COVID crisis committee, the bad boys of surgery, directors, advisory board, the department chairs, and the unit heads, the big support of the Department of Health, and of course, the ever-present assistance of IATF in the city of Manila. So thank you very much. Rounding off this fight against COVID with the vaccine, as I said, really gives us a big sense of hope that finally we will be able to defeat this virus. Thank you very much, and good afternoon to everyone.
Thank you very much. That is Dr. Gap Legaspi, the Director of the Philippine General Hospital, and always very reassuring. I think we all calm down when we listen to Gap and see someone who's in command and in control in a very gentle but very decisive way. So thank you so much, Gap. I think I'm going to turn over to Raymond for our next speaker, but Gap, you'll still be able to stay for our panel. I think there will be some exchanges and some discussions. So Raymond, over to you.
Thank you, Dr. Susie, and thank you for that reassuring message from our director from the Philippine General Hospital, Dr. Gerardo D. For now, let's call in our first reactor. He's the Executive Director of the Lung Center of the Philippines, none other than Dr. Vince Balanag. Dr. Vince?
Hello, good afternoon to all.
Good afternoon, sir. Go ahead with your reaction po.
Yeah. Well, it's a pleasure to be invited once more to the UP webinar series. So congratulations on your 44th. It has been 7 months after my first invitation to this forum and 1 year after the declaration of the pandemic and the national lockdown. Well, many things have changed, hopefully for the better, but many other things stayed the same, and I presume it may stay the same for a little bit longer. So I just like to congratulate Dr. Legaspi for that very comprehensive presentation, very informative on how what are the cases that PGH has been having, as well as the effect on their health workers. Now, whether it's a surge or a spike, well, we'll just leave it to the experts. I agree that most of the variant cases are probably in the western part of NCR, and as he has said, Quezon City is not one of the hotspots, and actually in my area of Quezon City, we haven't heard, well, at least among the patients coming to lung center, we haven't had a case wherein it was a variant. And I agree with Dr. Gap that probably it's not because of the variants, but rather laxity in the health protocols, and probably, as he said, pandemic fatigue. No, is there a surge already? Well, that's debatable. But what is important is the lung center feeling the effects of the surge. Well, with the present uncertainties about the virus and the actual experiences in our hospital, it is good practice really to anticipate a surge as part of our risk management plan. So this will keep our staff on their toes, continue to practice recommended health standards. It will ensure that the necessary resources like PPE, drugs and medicines, medical supplies, other important needs are well stocked, and enough supply for several months are available. And of course, the most difficult is ensuring enough beds for the incoming wave. So it's something that takes time to prepare, usually about 2 weeks, because we have to transfer patients to the other wards, get them discharged first. We have to re-equip or retrofit rooms and reassign medical and nursing staff. So timing is very important whenever there's a surge. Now, when in dealing with the number of cases and trying to find out if we have a surge, then of course we look at the numbers in the daily papers. I take a look at the daily reports in terms of actual statistics, in terms of volume and type of patients, as well as their severity. And every start of the week, we have a meeting of the incident command, and it's where we exchange our thoughts and experiences the past week and what to expect during the coming week. So I'll go to my slides to give you an idea on the number of cases we have. So next slide, please. So this is a graph of the monthly cases we had since the start of the pandemic up to the first 2 months of this year. So you would see that the initial spike was in April, then a bigger spike occurring in August. Then thereafter, the cases begin to decrease up to November, as a slight increase in December, and again, the lowest so far was in last February. You can also see the types of cases we have. The blue bars will be the confirmed cases, while the yellow bars would be those without positive tests. And you would see that in the early months, a lot of our patients are discharged or even die without a result in their COVID. But more recently, because of the availability of testing within the hospital, there are just a small percentage who are discharged or die without a positive COVID test. And you would see in the lines the trend in the mortalities. It would follow the total number of cases. So we had the highest number of deaths in August, and so far this had gradually decreased to less than 20 a month last February. Next slide, please. So this will show you the daily caseload we have since December 15. The yellow bars, I hope you can see them, would represent the COVID confirmed cases, while the lighter bars would be those who are COVID probable. So the baseline perhaps with us will be just 40 cases of COVID positive in a month. So whenever the numbers exceed 20, we begin to consider a spike, no? And we observe a spike during the latter part of December from 20 to the end, but it didn't increase significantly. Then it went back to the normal 20 COVID confirmed cases. But starting the last week of February, we began to see the spike increase, which apparently has continued at the present date. No? So from 20 cases, we now have a total of about 50 to 56 COVID cases, both confirmed and probable at this point. In terms of available beds, we have maintained 70 beds dedicated for COVID cases, even when we had the lowest number of cases. But it was only recently that we've sought it to increase the number of beds to 81 because of the anticipation that more cases might come in the coming days. Next slide, please. So this is the graph of the COVID cases among our LCP personnel. So again, just like in PGH, the number really follows the cases in the community, with the highest number occurring in August. I remember this was the time when we had our first webinar. When I reported it, it was just 14, and actually it went up to 38 during that month and 37 in the following month. But luckily, we were able to reduce it significantly by improving our health protocols, doing routine testing as often as 2 weeks among our staff assigned to the COVID wards. But again, there have been a small increase to about 14 per month from January to February, and now in March, just less than 2 weeks, we already have 14. So we anticipate that this month, this might be higher in terms of number of cases. So we had to do remedial measures to, and which I will explain later. Next slide. So as of March 11, yesterday, we had a total of 190 staff who had gotten the COVID infection. New cases since March, starting March 1 to 7, are 3 cases added up to the 15 active cases so far. So we have 171 recoveries and 1 death during this period from March 2020 up to the present. Next slide. So regarding our vaccination experience, well, just like everybody, we were alerted weeks before the start of the before the vaccines arrived. We had to make our micro plan. We had to do the staff training, standardized processes and procedures in the vaccination, took care of the logistics, cold chain management, syringes, and all the peripherals, readied our venues, and put emergency services near the vaccination venue. And we also did simulations almost every day to maintain our readiness. So this picture shows you the waiting area in our vaccination. This is where they fill up their vaccine forms and get to read the consent forms that they will need before they are registered. Next slide. So this is where we have the counseling, where then there is a short orientation on the vaccine that they will receive and the possible side effects that they may have, followed by them signing their respective consent, whether they will allow themselves to be vaccinated after the orientation. After this, there's screening, and when they are good to go by the physician, then they are directed to the vaccination area. Next slide. So this is our vaccination area, and we are showing you the first vaccinee in our center, the lung center, our OPD manager, and vaccinated by Secretary Duque himself. No? So this is the first among our vaccinees. Next slide. So after that, we have the minimum of 30 minutes observation in the vaccination area, wherein they get to have their blood pressures checked, their temperature, and whether they have any symptoms that may require further medical attention. And next slide. And for those who have more than mild symptoms, they are placed in an emergency treatment area beside the vaccination, wherein we have the proper medications, cardiac monitors, blood pressure, and even our resuscitation set and measures. Next slide. So we've started vaccination in the first day of March, just 20 for ceremonial purposes. But just like perhaps in PGH, there was an initial hesitation in getting the Sinovac, which forced us to do a town hall meeting initially to reassure them about the safety of the Sinovac. And it was then that it was announced that AstraZeneca was also become available shortly, and that made it difficult for us because at that time a lot of people were already preferring AstraZeneca over the Sinovac. So, however, perhaps after they've seen the minimal side effects of their colleagues, then more people began to be vaccinated. The following days, almost 100 vaccinees per day up to Tuesday this week, March 9. We allowed our vaccination staff to rest during the weekends, and we were able to finish the 600 doses of Sinovac. Almost 95% were consumed already, and we just had a few in store for those who opted for Sinovac but had to be deferred. We started our AstraZeneca vaccination on March 10, that was Wednesday, and we continue to do it today, which is our final day for our mass vaccination. And so far, the response has been good. And as observation of GAP, there probably are more side effects observed with AstraZeneca vaccine as compared to Sinovac. Next slide. So just to show you the uptake of the Sinovac and how the different types of health workers received it. So among our doctors, 47 had it, comprising 8% of the total doses. Our nursing, 149 or 26%. So we were expecting more among the nurses, but only this much had their vaccines with Sinovac. So there were 162 from the allied medical personnel, medtech, radtech, physical therapists, and the others, no? So 30% administrative, non-clinical employees, 107, 19%, and a lot of our outsourced availed of it, our security guards and our janitors, numbering 97 or 17% availed of the Sinovac, which we are really very much satisfied that we were able to convince them that Sinovac is a safe option as a vaccine. So you can turn off the slide, please. So basically, for the surge and the role of vaccines, well, the only way to really make a headway is to achieve early control of the surge by, of course, ramping up and accelerating the pace of our vaccination. We hope to vaccinate at least 85% of our staff today by the end of this day, and just follow up for those who were deferred or still hesitant to be vaccinated the following days. Of course, we have to keep on reviewing the current health practices in our areas, and we have to do well, we have to check the health practices in certain areas wherein some of the clustering are occurring. No? So actually, this occurred in our outpatient clinic. For our TB cases, there was clustering of 13 cases at one time, and we found out that the same reasons seen by GAP were operative. They eat together, sometimes without masks, and hopefully these were already corrected, and all of those 12 cases have recovered so far. And just like in PGH, we advocated the use of KN95 for non-COVID clinical areas, wherein before they used to use only regular surgical mask. We now mandate them to use KN95 at all times. We also increased the routine testing for our staff. Still 2 weeks for the staff in the COVID areas, but for the non-COVID clinical areas, we used to routinely swab them every 4 weeks. So we also started swabbing them every 2 weeks, because a lot of the results of the swabs are for those who were asymptomatic. So most of them were asymptomatic, but actually COVID positive. And these were true also for our administrative cases, wherein a lot of them were really asymptomatic at the time they were vaccinated. So these are the steps we have done to in the face of the surge, and we hope that we are able to have the necessary resources whenever more cases come in during the next few weeks. That is all. Thank you very much. Back to you.
Thank you very much. Thank you very much. It's Dr. Vince Balanag, the Executive Director of the Philippine Lung Center. Again, a very sobering calming and reassuring presentation of what we're seeing at the second COVID referral hospital. Thank you very much, Vince. I understand you can't stay with us, but thank you for your support for the program and for joining us today. We're moving to our third COVID referral hospital. And again, somebody that you know, all the way in the Tondo area, we have the Jose and Rodriguez Memorial Hospital. And we've got Dr. Alfonso Fritz Famaran, the hospital chief of Jose Rodriguez Memorial Hospital. Fritz, welcome to the webinar. Think nakamute ka, Fritz.
Okay, ma'am. Hindi na po.
Okay, sige. Kamusta ka dyan? How are you?
Ma'am, at the moment, ma'am, when it comes to the question of having a surge, no? Still, since the hospital's service capability is up to admit more COVID-confirmed patients, ma'am, I think na for us, wala pa hong surge dito sa hospital for COVID-confirmed patients.
So, but there has been an increase in the number of
That's true. There's a significant increase in the number of COVID confirmed patients being admitted per day, ma'am.
I see. Sige. So, what's your reaction, Fritz, to the presentation of Dr. Legaspi?
Ma'am, before I react, ma'am, I'd like to share with you, the statistic of the institution prior to reacting to the presentation of Dr. Legaspi.
Yeah, go ahead. Go ahead, Fritz.
So, can I request the first slide, please? Next slide. So, since we started as a COVID referral hospital, we have processed more than 2,000 COVID confirmed patients last 2020. We experienced to October 2020. And then this gradually declined during the last quarter of 2020. We then gradually opened our doors, our outpatient department and emergency medicine department for both COVID and non-COVID patients. Next slide. Next slide, please. We started the year with 300 COVID-related admissions, 94 of which were COVID-19 confirmed patients. So from the graph, we can see that we have an average of 3 admissions per day, presented by the red bar. Next slide, please. By February 2021, we had 110 COVID confirmed admissions out of 319 COVID related admissions. There was a noticeable increase in the number of patients by the last week of February 2021, with an average admission of 5 COVID confirmed per day. Next slide, please. So in this graph, you can see that that the average admission per day is around 5 admissions per day. For this month, March 2021, we can see a rising trend in the admissions by the first week of March, from an average of 3 to 5 COVID confirmed admissions per day. From the first 2 months, we are now admitting more than 10 COVID confirmed patients per day. we have decided to close our emergency medicine department because this is the primary source of admissions from non-COVID suspects and probable, and to give way for the COVID-19 confirmed admissions. Next slide. So if we try to plot it down in a single graph, can we really say that are we having a surge? Next slide, please. These red bars shows you the number of admitted patients per day for January 2021 to March 2021. It is obvious that if you look at March 3, 5, 7, 9, and 11, the number of admitted COVID confirmed cases are increasing from around March 3 is around 8 per day, and now March 11 is 27 per day. Next slide, please. This is now the truth of the data of the hospital for March 12, 2021. The total confirmed admitted patients is 125 patients in our wards. This is the highest number of admissions at CHD Metro Manila, no? And our COVID suspects around 5 with a COVID-19 probable of around 50. The total COVID-related admissions 180 patients in our wards. Next slide, please. This is the data on the COVID-19 confirmed HCWs. We have a total of 35 healthcare workers who had COVID-19 infections from January 2021 to March 2021. As you can see, we have 2 to 4 infected staff in a week. However, as this week, we already had 14 new healthcare workers infected, consisting of 4 doctors, 4 nurses, 2 nursing aides, 1 physical therapist, and 3 admin staffs, and 1 cook. Next slide, please. This is the breakdown of the COVID-19 confirmed healthcare workers who were infected from January 2021 to present. Please focus on the exposure side of the pie chart. It says here that the COVID duty data showed 2 healthcare workers. These are healthcare workers who had direct contact with COVID-19 patients at the wards. 30 of which was linked to community-acquired COVID-19 infection from the community. And 20, it says here, from the hospital. So 20 from the hospital, the hospital epidemiology surveillance unit is in question whether the infection really came from the community or from the patients that were entering the institution. So, however, these 20 hospital healthcare workers did not have any contact with COVID-19 positive patients at the wards. Next slide, please. So when it comes to the vaccination, the first delivered vaccine was Sinovac. 1,800 doses were given to us. We have vaccinated 648, and we have a remaining of 1,148. From the 1,148, we already allocated 655 for the second dose. For AstraZeneca, which was given last March 10 to 11, 1,000 doses, 500 doses were already allocated for the second dose. we finished vaccinating 500 employees, and we are expected to receive another 1,300 doses, good for 650 employees this afternoon. Next slide, please. So when it comes to the question of whether the hospital has indeed a surge or not, no? May I read to you the definition of a medical surge. It says here, it occurs when patient volume exceeds the hospital serving capacity. In this case, the patient volume of the hospital can be catered by the hospital services. Hence, in our institution, we can safely say that we do not have a surge of patients coming in, but there is an increase in the number of COVID-19 admitted patients. So as a reaction to Dr. Legaspi's presentation, more or less the data of UPPGH in our institution is more or less in agreement, no? And that second, the target for the hospital employees to be vaccinated is around 90 to 95%. At this moment, it's already 60%. 60% of the total population already vaccinated. So by the coming weeks, no, we expect to increase our vaccination percentage to around 90 to 95%. Ito lang po, ma'am. This is the data of Dr. Rosendo Rodriguez Memorial Hospital and Sanitarium.
Thank you very much. That's Dr. Fritz Famaran. Again, we're reassured by the presentation. I think we're seeing a common thread among the three hospitals, which we'll talk about a little bit more. Raymond, over to you. We have one more speaker.
Yes. Thank you, Director Fritz, and thank you, Dr. Susie. Our last reactor for today is none other than the head of the Philippine General Hospital's Infection Control Unit, and she's also faculty with the UP College of Medicine, Dr. Regina Berba. Ma'am Nina.
Hello, everybody. Susie, hello. And
hi, Nina.
Medyo nervous ako kasi sinunod-sunod niyo ako sa mga chief.
Hindi ka ng infection control, mas happy ka sa kanila. Okay, game,
okay.
Go.
So ako naman, I'm brave enough to declare that actually talagang we have a problem in PGH among healthcare workers, and based on everything we know now, we really have a surge of COVID-19 among our healthcare workers. Pinakita na to ni Dr. Gap kanina. But I wanted to just say na, you know, things can really change very, very fast, dramatically. Because this was just less than a month ago, nung February 9 to 11 talaga to when we collected blood from volunteers, and we actually had a lot of volunteers, close to 3,000 people came over to have blood drawn for specific antibody testing for SARS-CoV-2. And we were very pleasantly surprised na after 10 long months of intensive exposure to COVID-19, we still had 74% of our staff free from traces of COVID-19 infection. So kung ako nga tatanungin, sobrang happy ako nun. So kung magbibigay ako ng grade, sasabihin ko, excellent job. Pero, and that's because when we compare it to other areas in the world with published data and matching it around the same time when this was happening, kasi syempre nung February, iba na yung playing field nun compared to nung nag-uumpisa. But when you match what has been reported in literature, parang okay or even better yung performance ng PGH among healthcare workers, no? Based on this table that I made. So parang ngayon at in February of 2021, maybe we could compare ourselves with the data that came out of India, na yung kanilang healthcare workers in New Delhi had an average of about 25% seropositivity, which is very close to our 24%. Tapos kasi tinanong sa akin ni Dr. Raymond, paano ba nga namin na-detect na there was an incoming surge? So kasi we really come out with daily reports. So people who look at this are at once, 'di ba, parang clued in na baka there's something going on when the numbers go up. So lo and behold, very soon nakita namin talagang surge. Wala nang question, wala nang ibang way to describe this. And if you look closely into the numbers, we've really been doing well ng November, December, January, February. And then towards the end of February, there was this cases that started to be more and more and then just exploded into several more cases over the next few days. So hindi pa to tapos. Parang we're still seeing increase in the numbers, although baka nagle-level off na. So if you will see in this graph, there's the orange part of the bars and there's the blue parts of the bars. So we define this as yung orange community acquired at saka blue occupationally acquired. Walang ganito talagang definitions either ang CDC or WHO, and we actually put this together kasi we needed to just describe the infections that we were seeing among our healthcare workers. So pag community acquired, when we label them as from community, we mean that there was a household contact or there's a known community contact or that healthcare worker wasn't actually in PGH. So siguro hindi naman niya nakuha sa PGH yon in the last 72 hours prior to the illness, or he's not a person assigned to any of the COVID areas. Kunyari, nasa office lang siya or kunyari, security siya na never saw a COVID patient. Versus yung naka-blue na bars, which are all occupationally acquired. So these are people who worked in the COVID areas or were infected by PGH colleagues. So nakuha niya yung infection from colleagues na nagwo-work din sa PGH. So nangyari yung exposure sa loob ng PGH. So when you look back, when we really try to understand what's going on very fast, kasi all of this just happened in the last 2 weeks, we can identify two main reasons, just what like Dr. Gap said kanina. So most of the initial index cases actually came from community. Kaya lang ang problem, some of them came to work despite symptoms. And then had opportunities of eating together. And when we computed how many of this ended up as infections infecting other healthcare workers, we came up with the computation na for every one community-acquired COVID, parang nakaka-infection ng 4 to 5 other people in the hospital. So total of about 6. So in a very few, even kung kunyari 10 or ngayon parang ang count namin mga 15 index cases of community-acquired infections, nasa mga 70 plus na just in the last 2 weeks, no? So parang if you think about it, one might think madali lang to gawin. So if you stop people from coming to work if they're sick or were sick in the last 3 days, so dapat wag sila pumasok. And if they stop eating together while at work, baka ma-solve natin yung problem. But it's really easier said than done kasi parang ang hirap talaga nito gawin. So I saw some questions about ano ba yung context, why would people come to work even if they're ill? Kasi really the COVID-19, parang there's this, it's an entity that's sometimes difficult to recognize. Symptoms are mild, di ba? Minsan you wake up in the morning na may sore throat ka, you're not sure, ano ba to, COVID ba to, papasok ba ako or hindi? So many of our residents and the rest of the staff maybe go through this every day. It's really difficult to, there are some symptoms that are just not very, very clear-cut. So let's not take a blaming attitude on this. Tapos, pero ito, parang ito kailangan na talaga to makorek. Yung still don't know. Parang, hello, pwede ba, kunyari yung mga tao na tinanong mo, Sir, bakit ka pumasok? May lagnat ka. Tapos ang sagot sa'yo, pwede bang COVID-19 yung lagnat? Parang di mo na maintindihan where have they been in the last several months. There's a denial factor, so that means they don't think that they could have COVID, no? And they think it is other things. Yung feeling indispensable, so there are staff, and this one hindi ko rin to ma-blame kasi parang meron talaga silang feeling na kailangan sila pumasok, that our departments or our units won't work if they're not there. And economic factors, no work nor no pay. And of course, the pandemic fatigue factor. So may feeling na I don't care anymore basta papasok ako. So parang these things need to be properly contextualized and addressed para we can help our healthcare workers try to recognize all of this and avoid that situation of coming to work kasi it really leads to a lot of problems. So as was mentioned earlier, there's been a lot of improvements already that have been done and are being done. So when people ask me, how safe is PGH now? So siguro yung tawag nila granular o per area, per department, depende on where you are working. Basta if your area can practice universal pandemic precautions, your area should be safe. No? So yung hindi na sa PGH kasi, I don't think meron pang issue on the what we call the minimum health protocols. Lahat yun sinusunod na ng mga tao. We have an enhanced level of precaution and it's called universal pandemic precaution. So the concept there is dapat wag ka magtanggal ng mask kasi yun talaga yung parang lifeline mo the presence of the mask. So it really depends. For most part, I think people are trying to follow pandemic precautions, so it should be safe. Okay. How safe is the vaccination rollout at the PGH? So we've heard a lot of messages that are passed on in the Viber groups, diba? Of how we've had some positively confirmed vaccinators, pero all of them have been pulled out. We've been monitoring the whole system, and I can categorically declare that this setup continues to be safe. It complies to all infection control protocols. So yung kung hindi pa tapos magpabakuna, you can come today or next week according to your schedule, and to our vulnerable faculty and all other staff who still needs vaccination, punta po kayo kasi it is safe. And what about variants? So di ko alam kung alam nyo na po, pero as of yesterday, last night, 2 confirmed cases of South African variants are currently admitted at the PGH. So while it might cause some degree of panic or alarm or freaking out, it's really all about staying vigilant with the infection control measures. So I think this is under control. Whether it's adding to the problem with the healthcare workers, we don't think so. So medyo separate siya, and we're dealing with it. And I'm sharing this with you kasi all the other hospitals who are here, baka this will happen to you, pero you need to be prepared and just stay vigilant with your infection control measures. So dun sa kaninang pinakita namin na data about antibodies, parang ang bago dun ay meron pala sa ating asymptomatic. Kasi before we used to just think that siguro may asymptomatic, pero talagang here, parang we were able to give a number to it. So there's probably around 8% among us na baka nagka-infection along the way pero hindi natin alam. So after all has been said and done, talagang kailangan na tayong magpabakuna, and ang computation ko, dapat sana yung our PGH population to get over our surge needs to reach a target of 81% of our master list. And we're convincing all eligible staff to be vaccinated very soon. That's it po. Thank you very much.
Thank you very much. That's Dr. Nina Berba, the oops. Raymond, please take over. I think I lost you.
Okay. No problem. Thank you, Ma'am Nina. So Dr. Nina Berba po is the head of the PGH Infection Control Unit. At this point, may we gather all our speakers and resource persons for today. I hope we still have Executive Vice President Ted Herbosa and Dr. Vince Balanag has probably left po, no, to attend to an urgent matter. But we still have our main discussant, PJ's Director Gap Legaspi, and one of the other reactors, Director Fritz Famaran from Tala Hospital. But before we start with the questions po, no, let's just go through the poll results. We have most of our attendees coming in from Northern and Southern Luzon, Central Luzon, Western Visayas, and about 11 from outside of the Philippines. Again, we have 33% who are from the nursing field. Next will be from the medical field. And then the third one, believe it or not, medical technology po. Tinanggal ko po muna yung sa others kasi medyo hindi po siya nahimay-himay. Okay, let's start with the questions. Dr. Susie.
Okay, so I think we've got everybody. My question is, how do you get our health workers to stop eating in the hospital? Sige nga, ano ba? We saw this from the very beginning. Remember, Gap, from the very beginning, you're already saying this. And we're talking about it again. So how are we going to do this? Gap, what are you planning to do?
So, you know, we have a huge mess hall and we provide meals for everyone. You know? So there are two ways of eating in PGH. One, you go to the mess hall, get your food, and sit down and eat with the rest. The other one is you send an emissary to get the food for your office, and then you get it from that container and you eat together again. So those two areas we corrected yesterday. One, we will start distributing the food to the wards themselves and in packs so that they don't have to congregate and get their food. No? So at least for the surge that is happening now, so that the next thing that we have to take care of is how to make them eat separately. So Anina, I think we're pushing through with that corridor eating. We will provide seats along the corridors. The corridors in the second floor are quite comfortable because it's windy and it's shaded. So those are the things that we are employing. You cannot stop because you know Filipinos when they're sad they eat, when they're happy they eat. So hindi mo mapipigil talaga.
Fritz, how about in Tala, in Jose Rodriguez? Can you get people to stop eating together? Wala yata si Fritz eh. Fritz, problema ba sa inyo yun, kumakain together? Kasi you said the same thing na you know, the infection is not coming from the ward and it's not coming from the community, right?
Yes.
So what can you do? What are you planning to do?
I already tried delivering food sa offices, pero again, it failed. So, ang most feasible namin ngayon, ma'am, is to send, mukhang ano mo, ma'am, tulad ng bastonero, ma'am, sa local government na they have to check, no, during lunchtime. Ma'am, that's the most feasible way, eh. Whether there is social distancing, during eating time, eh. Ganun na lang, ma'am. Wala nang ibang choice, ma'am, eh.
So may police, tapos may ticket, ganun ba? And what do you think? You know, I'm just thinking, right? You can more or less control things in the hospital. I mean, I think, you know, you have some things you can do, but can you imagine other organizations, other offices? So Ted, what is the thinking here at the National Task Force? We're already seeing that this seems to be the way that this virus is moving around with gusto.
I will say two things, no?
Yeah.
I noticed that in our visits to the hotspots, I noticed si Secretary Galvez never eats. He
Uh-huh.
will wait to get in the car and eat something and bite the food himself. So he doesn't remove his mask. He really doesn't remove his mask because he said he has to be extra careful because they go to meet the president every time. So that level of diligence I admire. Kasi ako careless like the rest of the healthcare workers. But there's an interesting setup that we visited at the Research Institute of Tropical Medicine. Sa RITM, when we visited it, we were asked to eat. Lahat kami, pati sila Secretary Duque. We ate in the cafeteria, but we were all given one table. We were all facing one direction. Our tables and chairs were 1 meter apart. And I think that's the standard eating setup. And we tried to put the chairs together and sit face to face. There was a marshal. There was a marshal that avoided us. So this is something be done in the other talagang pasaway kasi yung mga doctors natin. They will eat together, face each other, and then take that time to chat and relax. So I think what's important is really the bastonera that will tell you, hindi mo pwede baguhin yan. You cannot rearrange the setup. So sila Secretary Duque, sinabihan din ng Marshal. So I think that's one way to change behavior. Really very strong regulatory forces. Kasi alam mo yan, Susie, di ba? Behavior is the hardest to change, di ba? So kailangan talaga tutukan. So but I agree. I think now that people are again scared of the surge, baka susunod sila with just monitoring.
Yeah, I'm kind of thinking that
baka dapat may camera pagkatapos may public address speaker magsasalita si Gap. O kayo, maglayo kayo dyan.
No, seriously, I'm kind of thinking that
wala yata.
if the need is to socialize.
Wala yata si Susie.
Ayan, am I back?
We can hear and see you, Dr. Susie. Go ahead. Okay.
So I'm kind of thinking that if the need is to socialize, right? Kasi bukang yun ang sinasabi ni Gape, when we eat, when we're happy, we eat. When we're sad, we eat, right? It means that, we have an inherent need to really interact with other people. So maybe people have to eat separately, but maybe we should really have some kind of time where people can interact without removing their mask. So they still get to kwentuhan, they still get to ganyan, pero walang food. Kasi parang by removing their ability to interact during that break, right? We're actually depriving them of a very human need.
Downtime.
Yeah. So I'm just thinking there might be something, right, that they can do even in a group, right? They could be in a group, they could be in their mask, they could be in their face shield, and they could be interacting, but no food allowed. So siguro baka meron tayong iisipin na ganon kasi mukhang yun yung root need nila, no? We're going to try to end the conference at the top of the hour because some of our guests need to leave. But Raymond, let's go through the questions and try to get answers from our panelists.
Okay. Thank you, Dr. Susie. I'm just going through the pre-test polls. Okay, there we go. Anyone po can jump in and answer the questions. We have 3 for today. Number 1. Okay, number 1, there is a significant increase in COVID-19 cases. And what do you think is the cause? The options are relaxing of public health measures. Option 2, COVID-19 variants. Option 3, more mobility. Or option 4, all of the above, Cuba.
This is Nina.
Yes.
Nina, dumadami.
Go ahead po.
Baka all of the above.
All of the above. Thank you po. Thank you po. The next question will be, why do you think there is an increase in hospital admissions? The most selected po is all of the above, but the second most will be increase in COVID-19 infections. The other options are limited access to community quarantine facilities, and option C, more aggressive testing.
Yeah, I think there's more testing available. And I think what changed in the last 10 months is that the health-seeking behavior also improved. Kasi alam naman natin, ang lesson ng unang-una sa COVID in the early days, pag late ka nang dumating sa hospital, the probability of you worsening rapidly is very high. Correct. So I guess that was conveyed to people. And now, in fact, I think you'll see a surge of mild infection, mild symptoms, getting requesting admission to the hospital. No? So it's really the increased awareness to the course of the COVID infection, and of course, the increased testing.
Okay. Thank you, Director Gap. And then finally, what should we do about the increasing cases? 82% selected get vaccinated po, no, as primary of their choices. But the second most, I believe, is wear mask and shield. So marami pa rin po ang naniniwala sa public health measures, and then avoid interaction with people and aggressive community testing round up the top 4. Any comments po from the group? Maybe Director Fritz.
At the moment, hindi naman natin mapigil yung pagkakaroon ng ng infection because of the COVID-19 confirmed asymptomatics, no? Hindi na natin mapipigil yung increase in the number of COVID confirmed because of the massive vaccination we're having right now, kasi it will take some time for the individual to develop antibodies to the COVID-19 virus. So ang the best talaga natin ngayon is to adhere to the minimum health protocols natin, no? Wearing of the face mask properly, face shield properly, social distancing at least 2 meters, washing of the hands, and so forth and so on.
Yeah, okay. Thanks a lot, Fritz. I mean, and maybe dapat meron tayong pa-scrabble tsaka pa-bingo sa mga ospital natin. para may chance mag-interact na walang pagkain. No? Okay, so we're going to go to, Raymond, we need to launch a quick evaluation. You want to do that right now?
Oh, yes. So typically we have this assessment of our panelists just to be able to gauge po ang inyong natutunan. I'll go through the list, and hopefully our 1,700 plus attendees still are able to key in their responses. Number 1, panelists demonstrated thorough knowledge of the topic. Number 2, the panelists were well prepared and organized. Okay, I think it got stuck on my end. Is it moving on yours, Dr. Susie?
I can't see it also, but let's just run that. And I think, we still have 2 questions from the audience, and we're going to ask them to open their cameras, I think, but we need to make your questions really quick because we want to end on time. So can we have the first question, please?
First question, I think, will be coming in from Sir Rainier, if I'm not mistaken. Sir Rainier, go ahead with your first question po. Sir Rainier Astin Sindayan.
Okay, let's go to the next.
There might be...
We can't open.
Okay. The next question will be coming in from Ma'am Maria Cecilia Pulido.
May message, no option to unmute. Dapat i-unmute yung speak.
Okay.
Participants.
Ano ba to?
Ma'am Cecil, go ahead with your question po. Sige po.
Hello, good afternoon po sa inyong lahat. Maraming salamat po sa Stop COVID Deaths sa inyong presentation po para sa mga impormasyon tungkol sa mga impormasyon sa COVID. Ang tanong ko lang po ay ano po mga measures ang ginagawa po natin para po mabawasan po yung tsansa na umakyat po yung surge sa healthcare workers, pati rin sa ating communities. Tapos paano po yung sa contact tracing din po? Anong ginagawa po sa mga communities natin? Maraming salamat po.
Okay, thank you very much, Cecil. Anybody can answer?
Lucy, ano ulit yung tanong? Sorry.
What are the measures to protect the healthcare workers? Both in the hospital and the community.
Well, sa PGH, yung healthcare workers are provided lahat ng kailangan nila in both for care of the COVID patients and for the care of all other patients. So, lahat po ng ways to protect them in terms of, for example, PPEs and other measures are being given to them. Plus knowledge, tsaka yung mga IEC materials, plus some support, yung mga psychological, mental, social support mechanisms po. Kasi kailangan rin po yun ng mga healthcare worker under these extraordinary times. So, yeah.
Okay, thank
And
you.
extensive contact tracing. Yeah.
Okay. So I think
Susie.
Rainier cannot come on board, but he has a question. Ted, yeah, go ahead. Sorry, go ahead.
Yeah, I was gonna say, for the community, what I've noticed in NCR is I think only 4 cities were able to continue to address the aggressive community contact tracing, the aggressive contact tracing. Yung testing natin parang okay eh. Our level of testing is mataas eh. Pero tumataas yung positivity rate. Pero habang tumataas yung positivity rate, hindi tumaas yung contact tracing capability. Nakita namin parang yung some of the contact tracers that were hired and trained during the initial peak, natapos na yung contract nila kasi mga job order lang sila eh. So wala namang contact tracer. So I think very important mabuhay uli yun, yung contact tracing ng bawat local health office, local health units. Kasi that's the only way we can stop the transmission. Getting the contacts, isolating them, quarantining them, and then testing them.
Yung the basic public health.
Basic. Oh.
I think, Raymond, do we have the question of Rainier? Because he's saying here in the chat that he can't unmute, but he does have a question, although I don't see what.
I'm looking at the question that probably is the most upvoted question here. Thank you, Sir Rainier Sindayan. I'll read your question po from the Q&A box. It reads, how do we properly contextualize the issue of mga pasaway who continuously being invoked as the drivers of increased COVID-19 cases? How do we comprehensively address the observed surge of cases where the approach will not only be a return to more lockdowns and curfews po?
Anyone? Good question. Anong gagawin sa pasaway? Kailangan mag-bingo sila.
Hindi, regulation talaga. If it's sa Filipinos, I think that's why the certain people are complaining why we are using the police to impose public health measures. And that's basically why. If everybody just followed the behavior and got educated about how COVID is transmitted, hindi ko kailangan ng police to impose the wearing of mask and wearing of face shield. Pero dahil kita mo nga, nasa labas, naka-face shield, pero headband yung face shield, yung face mask nasa chin, talagang we need the enforcers. I think that's basically the same system in the hospital, yung kinuwento ko kanina. Yung may marshal, even in the hospital, you need that marshal to tell you, teka muna, you're together, stay apart, diba? Or put your mask on, or put your face shield. I was in a 5-star hotel, I won't name it. I went to the toilet from the eating place. Siyempre, I'm walking, baka madapa ako, nilagay ko yung shield ko on top. May lumapit ka agad sa akin, sir, your face shield, pakibaba. So I think that type of reminder should be the way to go for our local chief executives.
Right. Okay. Thank you very much. That was Ted Herbosa, TVUP. Okay. So we're going to ask everyone to give their parting message. But to make it a little different, I think I'm going to ask you in your parting message just to say, where do you think this is going and how do we prevent it from becoming worse? So we'll start from the ends. We're going to start with Nina. Where are we going and how do we prevent this from becoming worse?
Ako, I think yung prediction or forecast ng Octa Group might really happen. It will get worse first before we get better again. No? Kasi there's a lot of things that need to be done. The higher the numbers kasi, the more difficult it becomes to get it down again. Yun. So, yung question kung paano natin ma-overcome all of this, I think key talaga yung discipline eh. We really need to do that. Tsaka yung timely response. Alam nyo, yung the reason, 30 seconds lang, Susie, I realized.
Go ahead.
May critical time that the COVID is very infectious eh. Yun yung just around the time na magkaka-symptoms ka. At saka first few days. Now, when our contact tracing happens like 1 week later or 2 weeks later, parang useless na yung isolation. Some people like wait for them to get the results of the test before they isolate. So, parang ganun, very mixed kasi yung signals na messages natin. So, pagka lang we stick to science and we stay disciplined, I think we'll finally get it all aligned and maybe overcome this pandemic problem. But there is hope.
Nina.
We'll reach it soon.
Thank you, Nina. Fritz, saan ba ito papunta? Tsaka paano ba natin mapipigilan na hindi na dumami yung kaso?
Yung unang tanong, ma'am, saan papunta, no? So, still, ang trend is increasing pa rin yung confirmed COVID cases. By experience, dito sa hospital ko, compared dun sa graph nung previous, hindi steep ngayon ang increase as compared before, no? So mukhang na-lessen yung degree nung graph, no? So hindi ko lang alam, ma'am, kung kailan mag-i-end yung rise ng cases. And then prevention, ma'am, aggressive vaccination, strict adherence to the minimum health protocols. Tapos, in our hospital, kaya ko konti lang yung healthcare workers ko na infected. Very strict ako dun sa protection o level of PPE na sinusot ng aking mga healthcare workers. And lastly, hindi na ako nag-adhere sa every 4 weeks na mandatory swabbing. Ang ginawa ko, every 2 weeks na, ma'am. So mas marami akong nahuhuling COVID-19 confirmed na asymptomatic sa mga healthcare workers ko.
Okay. Thank you very much, Fritz. We're gonna ask Ted Herbosa because he needs to leave. So, Ted, where's it going? How do we stop it from becoming worse?
Yeah, whatever you call it, spike, surge, there's an increasing number of cases at the PGH. They have an increasing number of admissions. I think we need to go back to basics, go back to all the Swiss cheese fences that we've been doing, face mask, face shield, wash hands, avoid crowded places, stay home if possible, and then reiterate this to everyone, and then get vaccinated. We now have an added, unlike last year, we didn't have the vaccine this year. We have the vaccines coming, even if it's in trickles. Make sure everybody gets vaccinated. I think another 1 million doses of the Sinovac will arrive end of this month. So that should complete the healthcare workers. When we deploy that, we will get another set of vaccines, and the senior citizens can now be started, the public, the lay public. So we do hope ma-remind natin everybody. I think talagang tataas if we continue this current behavior. We were able to do it before, flatten the curve. I think we should be able to do it now, early on, to flatten this curve. Thank you.
Thank you very much, Ted, and thank you for being with us today. Okay, so Gap, the last word is yours. Go. Gap, nakamute ka.
I think as we've seen in the past, it will go down eventually, but how high will it go? That's for us to see. I'm just more optimistic now because there are a lot more things that we know now that we didn't know last July or August. And there are a lot more consequences that we know now that we didn't know last July and August. So I think we're in a higher baseline to fight whatever this is, whether a spike or a surge. And that's why probably the center chiefs don't sound too concerned, because we trust our people despite the healthcare worker infection, but because we trust our people already, that more or less they know how to react to the situation, and then plan on and also participate in how to bring it down. I think pivotal to all of this is behavioral modification and control. No? So siguro kung meron tayong iibahin na approach is really to think of other ways to modify behavior that will lead them to be more compliant to the healthcare protocols. So the unseen factors are coming into play now. No, that those that we don't really see on a daily basis, and I think a hard and fast contact tracing will really help bring this down quickly also. So I think we'll do better this time than July and August.
Thank you very much, Gap, and thank you for your time with us today. Okay, we're going to a brief summary by Chancellor of UP Manila, Menchit Padilla. Menchit, over to you.
Yes, so the started opened by UP, and he shared with me this web series was just an idea 11 months ago and has transformed to a grand project. 11 months ago, our society was here, but UP through TVUP offered an alternative platform. So this is the backdrop of the TVUP webinar series that you are watching every Friday. Dr. Legaspi, the question, is it a spike or a surge? He said it's probably just a spike. Middle of populous areas, it makes PGH in high risk. And once you have a high risk in the community, it corresponds to a high risk of positivity among the health workers. But it specifically cited mobility and laxity in the health protocols as probably the major contributing factors. They've identified the following factors, and I think this is important for our audience now, that the factors that identified that contributed to the transmission were the following: eating together, sharing the call room, maybe the variant. These are factors that we can actually modify in the hospital setting. They have taken major steps in PGH, and I think this is something, again, that reduction, the ski sent home the interns, a work reduction, deferment of elective surgery. They enhanced their health protocols. Now it's a K95, contact tracing and targeted testing. Of course, we have the vaccination launch of Sinovac and AstraZeneca. Message of Dr. Gapi, seen any vaccine that is. We actually had two hospital directors who reacted. I'd like to combine their feedback. They're quite very similar with some differences. For the lung center, since QC is not, Quezon City is not a hotspot, they may not be experiencing the same kind of infections, but he said this is an opportunity for us to actually prepare for another income. Together with Dr. Famaran, they had the same observations. There is a laxity of community health protocols. They actually both address the increase in positive cases in the hospital by increasing the frequency of testing within the hospital. They both launched the vaccination plan, convinced their community of health workers to take the vaccine wherever is available. I think the three actually are doing their best to convince the health workers to take every vaccine is available. Our last reactor is Dr. Nina Berba, and I just want to concentrate actually on a few points she raised, highlighting the community-acquired infection, the occupationally acquired infection. And in a controlled situation, actually, there are more cases that you get from the community. And I think that's the reason why we have to work hard in making sure that we control the infection in the community. The other message she said is that the mask is a lifeline. I think we should remember that, and vigilance and control measures will be very important. Just for a few words on the final words from Dr. Berba. Oh, by the way, Dr. Berba is the only one who said we have a surge in PGH. The three directors were saying that it's probably not just a surge, just a spike, but our IDS especially is saying in PGH is a surge. Just to the final messages for Dr. Berba, she said that if we do not discipline ourselves, the octopredation might happen, and we have to go back to the basics and the minimum health protocols. We heard it from Dr. Famaran and also from Dr. Legaspi and Dr. Herbosa. All of us, we just have to go back to the basics and the minimum protocols. But Dr. Gap actually ends by saying that this time you are more optimistic because we have seen, we know more about COVID-19. So this time we have a better chance in this fight. At the end of the day, it is going to be behavior modification as a major factor for the control of infection, both in the community and the hospital. Back to you, Susie and Raymond.
Thank you very much. Thank you very much, Chancellor Menchit Padilla, for that very concise summary. And next week, please join us. We're still going to talk about COVID vaccines. And our topic is COVID-19 vaccines. Naiinip ka na ba? I think a lot of you want to get vaccinated. We're going to talk about the rollout. So we're going to have a speaker from the Department of Health and some other experts to talk about how soon we're going to be able to get that 80-90% of healthcare workers kayo, paano kayong mababakunahan, no? So yun ang topic po natin next week. Please join us. Raymond.
So I think marami po tayong natutunan for this week. We're very, very lucky, very fortunate, and very grateful also to have the three medical directors of the NCR COVID-19 referral hospitals. It's not every day that we could get the chance for them to stay with us for at least an hour or so to discuss the status. We also have one of the top infectious disease specialists, Dr. Nina Berba, to join us. Anyway, we will be going back to our really main topic of the vaccination rollout program, and especially those who are in the outside of the National Capital Region, those who are really excited, anticipating kung kailan po ba mabibigyan, magsisimula ang mga pagbabakuna sa kanilang LGU, particularly dun sa mga A2 and onwards po, sina senior citizens, sina indigents. Sana po ay magsama-sama po ulit tayo at makinig at manood po next week, Friday from 12 to 2 p.m. It's a date.
Together, let's stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others laugh before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? Oh God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Just look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others laughs before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? But God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The other thing before my fears, pushing on despite the tears. Please take us through another day. Just hold my hand, I will hold the line. I will hold the line.